Good morning. This is Brian Lee, Tidus County Judge, and I'm here with Terry Scoggin, the Chief Executive Officer of Titus Regional Memorial Center. It is Wednesday, the 25th of March, and it's just almost 11 o'clock, but I know there's some concerns out there and questions from many of you, as I have seen and heard, and so we wanted to give you a chance to hear directly from the best source that I've got right now here in Titus County. So, Terry, one of the questions I've got is Titus Regional Medical Center testing for coronavirus, or is anyone else testing in this community?
Sure. From a TRMC standpoint, we are testing for the COVID-19 virus today. The process we're using right now is a screening process. That screening process was developed by the Center for Disease Prevention and Control, the CDC, as it's better referred to as. They have several questions that will be asked. So we ask those questions, and then we start looking at symptoms. We're looking for a fever of 100.4, 100.4. In addition to that fever, we're looking for cough. So dry cough, fatigue, those are the symptoms that we're looking for right now related to this. If we have those symptoms, we're going to give the patient a mask and we're going to take them to a room and start doing more tests on them. If they meet the criteria that's been given to us by the Texas Department of Health, then we will call the Texas Department of Health and get permission or approval to do a testing. It's called a PUI number, so person under investigation. If the state approves us to do the test, we'll do the test. Tests are still limited across the state of Texas at all hospitals, so we're using the Texas Department of Health. You're going to see some numbers over the next few days. Private labs started last Thursday doing tests. We'll start using private labs. That's going to open up the ability to do tests more in the future. But right now, we're going through the Texas Department of Health first, then we're using private labs if necessary. And the reason why is turnaround time. The Texas Department of Health for Titus is turning us around between 24 and 36 hours. We know the location of the Texas Department of Health that's doing the lab. We drive the test straight to the lab to have it done as soon as it's drawn. And then 24 to 36 hours is turnaround. We're having a better turnaround than other health systems. We have tested 7 people. All 7 have been negative at this time. We're continuing to monitor those. We had quite a few more qualify. We talked to the Texas Department of Health, and they ruled them out. The ones that are ruled out, if we think there's still reason we should be tested, we'll call back and appeal. And then if so justified by the provider, if the symptoms continue to get worse, we'll use a private lab. The reason why we're not going to the private labs right now is the turnaround time is 7 to 10 days. We expect over the next 5 to 7 to 10 days more tests to become available, and even at-home tests to become available in the next few weeks. We're on phone calls every morning, every afternoon. The FDA is trying to push tests and get the research done, the approval of tests done quickly. Over the last 3 days, we had major changes. Once on Monday, we were allowed to use a different type of swab. So we've gone from 25 kits to more because now you can use a different swab per the recommendation of the FDA. Today we find out they're going to be able to use a cotton swab, which will increase the ability of tests that can be done and put more on the market. We believe there'll be a point of care test available in the next couple days as well. Our lab is working closely with our friends in Tyler, Texarkana, and Dallas to see if we can get that equipment here. If not, we'll have relationships to get that test. So testing will increase over the next few weeks. Just to give you some numbers, through today, we follow this closely. 13,235 Texans have been tested, 1,758 in the Texas Department of Health. The rest are done in private labs. As of 6 days ago, 0 were done in private labs. So you can see 11,000 tests done in the last 6 days. They don't tell you how many of those have been resulted. And that's the big question right now is, yes, I can get you tested, but how quick can we get those results back? They are prioritizing these tests through hospitalized ICU patients first, healthcare workers that have been in contact with COVID-19 second, hospital patients with symptoms but not in ICU, outpatient, and then self-referral testing. So the labs that get it have a priority of how they're going to do the lab testing. We're hearing from Washington on a consistent basis that will increase and we'll get more testing. We had an expert, Dr. Rick Yates out of Tyler, Medical Director of Infection Control for Titus, was here Monday, meeting for our medical staff. More testing is going to become available. He's also started about the work that's being done by the private labs on the vaccination and would expect the vaccination to be in the next 6 months as well. So a lot of work's being done over the last week, as the private labs have got involved, a lot of things are turning. So we'll be able to test more. We've already worked with Chief McCrae and the county, city fire chief, and also the county emergency disaster lead on preparation that once mass testing is available, we have the plan in place that we'll be able to do that in the Tidus County area and work that out.
That's great. And as you know, Terry and I meet each morning along with another large group of leadership throughout the county, and I'm talking about schools, law enforcement, city manager, city attorney, the county attorney, the college, and we all have an opportunity to share information at 10 o'clock every morning, so we're making that a priority. We just completed that conference call here shortly. Terry, you were telling us on the conference call how the hospital is being impacted. Tell us about your census numbers, how many patients you've got, what's traffic like in the emergency room?
You know, right now traffic is slow. Our census is about 40 to 50 in the hospital today. We usually run between 50 and 60, so we have bandwidth today. Emergency department's running between 40 and 50. I appreciate the community of Northeast Texas, Tidus County, and the surrounding counties. They're heeding the warning. If you don't need to come to the emergency room, please don't. Call your provider. Check our website at titusregional.com for information about symptoms and if you're sick or not sick, who to call. But people are not coming to the emergency room in droves, and we appreciate that right now. If you're sick, you need to come to the emergency room. But if you are able to work with your provider, talk to your doctor, call them. The traffic has been pretty slow. We are limited by the governor's orders of some procedures that can be done right now. So that's limiting and just the small traffic in the hospital right now. We are screening all visitors. We're screening all patients who come in. Every employee, visitor who come to the hospital will be asked certain questions, and we'll do a fever temperature check. I have a dot on that shows I was screened this morning. So you've got your badge on. I was hoping you had your wristband on. You were screened. So we're screening everybody that comes into the health system. We're limiting the hospital. If you don't need to be in the patient tower, we're trying to keep people out of the patient tower to protect our doctors, our staff, and our patients as well. My father, I'll just give you a story. My father is a patient right now. I haven't seen him in 5 days. So he's less than 100 yards from me, but we have a visitation policy in place right now. Me or my mother have not seen my dad since Friday night. We did the visitation policy at 6. My dad was admitted at 10, and my mother's not too happy with me right now. But that's the policy we're sticking. And I truly appreciate everybody who's working with us. Our community has been phenomenal on working with our health system.
That's great. You had mentioned the number of tests that have been done, and as of this morning, Tidus County still no confirmed cases. Sure. Is that still correct?
That is correct. As of this morning, we have one outstanding test that was sent to a private lab. We're not expecting that test back for 7 days, but we have no positive cases around us right now. Most of the counties, some of the counties have one case. It's not hit this area yet. It is a contact disease or a virus. Us being in an open space is helping. We're not on top of each other. We have a little more land in this area that we can spread out and social distance ourselves, so it's not spreading as quick in Northeast Texas. Right. We talked about it this morning, and then on the radio, Patty Beckman talked with Carrie and the team this morning on the radio. It's not if we're going to get a case, it's when. Our infection control medical director made the comment the other day is we're going to have to learn how to live with this virus in the community. We're all going to touch it at some point. 80% of the people who come in contact will be fine. Maybe mild flu symptoms, probably not even that. A lot of us are going to have it and not even know it. That 15 to 16% get a little sicker, so a really strong flu with the respiratory issues. Then that 2 to 3% are going to be really sick. And that's the high-risk population. If you're high risk, which means you're greater than 65 years or older, you have a chronic heart disease, chronic lung disease, diabetes, any of those issues or medical diagnosis, you're high risk. And we encourage you to stay at home. Self-isolate yourself. Be careful with your grandchildren coming over and different people, especially kids from college who aren't in college right now. Maybe it's not the time they come over. Get on FaceTime, talk to them on the phone. They can transmit that virus. Assume everybody has it. Assume every doorknob you touch has the virus on it. Wash your hands constantly. Good hygiene. The other day I did a Facebook Live and I broke a pin in my hand, so I was showing to wash my hands. They were covered in black, so my friends give me a hard time. But wash your hands on a constant basis. If you sneeze, sneeze into a tissue, maybe your arm, away from people. Don't touch people if you don't have to right now. And that you're talking to the guy who's hugged everybody in Northeast Texas or shakes hands on a regular basis. But this is a new norm that we're going to have to get used to. And 6 feet apart is recommended, 3 feet for each person. If you have to sneeze, try and cover your mouth and wash your hands. Don't touch your eyes. Don't touch your nose. The main the main transmission of this disease right now is contact. Talking to HCA, the largest hospital in the U.S. yesterday, they're out of Medical City in Dallas. In their system, they have no COVID-19 transmission to any of their providers when both the patient and the doctor were wearing a mask, and not even the N95, just a regular surgical mask. So if you have fever, if you have those symptoms, but you don't have all the symptoms yet, self-isolate yourself for the rest of your family. Maybe put the mask you have at home over yourself, but just clean, wipe down. The regular Clorox bleach solutions work fine right now. Alcohol-based solution have to be 60% or more of alcohol-based. Use those right now. Clean, clean, clean. That's the most important thing we can get for at home and even businesses as well.
Let's talk about businesses.
Sure.
We do have some businesses that are open. Unfortunately, our restaurants are closed for in-store dining. But if we do run a business, what are some steps that we can take to protect not only our employees, but the customers that come to our business?
Same thing, clean constantly. I encourage all the employers, consistently wipe the doors down, consistently wipe the tables down, the counters, the cash registers, the menus, wipe them down with a disinfectant, normal and disinfectant they use. As much as possible, wipe down. Maybe have the lines a little spread out. You notice when you came in, we had tape on the floor at 3 feet intervals, trying to keep people in a line. If it's a closed area, open the door. We're trying to keep people out of closed areas per the executive order we have as well. Isolated areas is where the problems go. So open the doors, keep that flowing, good ventilation, and just consistently wash your hands. Good hygiene from both the businesses, also the customers as well.
Very good. Let's talk about shopping habits. We were talking about that this morning with Chief McCray, and again, Chief McCray, Larry McCray, is our fire chief for the city of Mount Pleasant. He is also our emergency coordinator for the entire county, and so Larry is a great source of information. But one of the things that he was telling us today is about the tremendous amount of water supply that we are blessed to have here in Titus County. There's plenty of water through the city of Mount Pleasant, through Tri-Water. There's no need to be buying and stocking bottled water. If you just are somebody that likes to buy bottled water and you just can't do it any other way, well, that's one thing. But let's not buy up all the supplies of water. There's absolutely no need for it. Toilet paper is another thing. We've had a run on toilet paper. It's still hard to get toilet paper, and that's unfortunate. If you've got a whole stockpile of it, let your neighbors and friends know about that. There's plenty of toilet paper out there. We're not having to use the bathroom anymore just because we're dealing with coronavirus. Another thing that he mentioned, and this is important, don't use non-toilet paper products in our sewage system. There is a real problem with backup that can be caused by using a product in the toilet, in the sewage system, that can't be easily flushed right on through and biodegradable. So keep that in mind as well. One of the best resources that we've got for just up to the minute information is going to be through the City of Mount Pleasant website. Susan and Mark Brooks, the web servicing company, is doing a great job of bringing together all kinds of information that you can access. mpcity.net, a great place to get information, and it will lead you to a variety of other resources if you're looking for that information. So keep that in mind, mpcity.net. Act as if you're contagious. Keep your distance, wash your hands, be smart. Let's keep these numbers low. And as Terry just told you, it's not a matter of if, it's a matter of when. And just because we see a positive case pop up here in Tidus County, that's not cause for alarm. But let's continue to do our part and strive to keep that number at 0. but each one of us has got to take individual responsibility. Say thank you to our local businesses that are suffering through this. Fortunately, we think that the lawmakers have come up with an agreement, and they will be getting some financial assistance and support that will trickle down to individuals that are having to deal with this. So be patient there. I know that they're going to act as quickly as possible. But again, keep in mind these folks that hire employees and the employees that are not able to work. We've got hourly folks that are out of work and are going to be suffering in the days and weeks ahead. Say thanks to those businesses that are having to keep their doors closed, specifically our restaurants. Give them some business with a takeout order. Most of them are open for drive-through. Anything else?
No, I just want to thank again our Northeast Texas community. Thank you for your patience, and as we go through this, as the judge said, please, I'm asking to stay calm. We'll get through this together. Help your neighbors, help your family at this time, but most importantly, just stay calm. We'll get through this together. And again, I'd like to thank all our doctors and our staff at Titus Regional Medical Center for being heroes at this time and coming to work when we're trying to keep people home. And I want to thank the family members, the spouses and the children of our staff and our doctors for allowing their moms, their dads, their brothers, their sisters to come to the health system right now and work at the front line as we're going through this crisis. So each one of them, thank you for making us who we are.
Thanks again for watching. We will keep you updated on a daily basis, and again, we're having that conference call each day, and any information that we glean from that conference call, we will be sure to share it with you one way or another. Keep an eye on my Facebook page for Tidus County Judge. Keep an eye on mpcity.net for additional information. Thank you.